This is part 2 of the presentation on mitochondrial dysfunction in autism. These are the components of the mitochondrial cocktail that is used at Johns Hopkins University. And these are the components that have been incorporated into the product Mitospectra, which I was involved in creating. There are many other vitamins and supplements that might be considered in the treatment of mitochondrial dysfunction. They include, as you can see here, a range of different B vitamins, L-creatine, alpha-lipoic acid, and L-arginine. There are also some recent research studies that have looked at other natural supplements in the treatment of autism, and these impact the function of mitochondria. Sulforaphane is one of them. N-acetylcysteine is another. And in this study, which was done by researchers at Stanford University, they found that treatment with N-acetylcysteine led to improvement in the symptoms of autism. There are several publications that provide a summary of the research literature and dosing for different supplements that may be beneficial for mitochondrial function, and you can see them here. And again, here is another list of potential vitamins and supplements that might be used and guidelines for dosing. As you can see, putting together a mitochondrial cocktail involves quite a lot of different components and different dosages, and those components and the ratios of the dosages are quite important and do need to be tailored very specifically for a particular child. There are also steps that can be taken to optimize diet and lifestyle, and these include limiting fasting, increasing meal frequency, and improving hydration, avoiding mitochondrial toxins like certain medications, although it's important to recognize that in some children these medications can be extremely helpful. So these medications are not contraindicated for all children. There may be cases in which they should be used. Avoiding physiologic stressors such as illness, dehydration, fever, temperature extremes, surgery, anesthesia, prolonged fasting, or starvation, especially in combination. And providing supportive care during conditions of physiologic stress, including hydration, nutrition, and certain vitamins and supplements. And finally, consistent moderate exercise, which may in fact be one of the most important. Exercise leads to a whole set of different physiologic changes that ultimately improve the function of mitochondria. So consistent daily moderate exercise for at least 30 minutes is essential. What changes are possible with mitochondrial supplements? This is a summary provided by the United Mitochondrial Disease Foundation that I think is important to include here. And they say sometimes treatment may be beneficial and noted immediately. Sometimes the benefits of treatment may take a few months to notice. Sometimes the benefits of treatment may never be noticed, but the treatment may be effective in delaying or stopping the progression of the disease. And sometimes some patients may not benefit from therapy. This is a research study looking at the supplement L-carnitine in children with autism for a period of 3 months, and they found that this did lead to an improvement in the symptoms of autism and in muscle strength. And now I'd like to present to you a couple of cases that illustrate children who've had mitochondrial dysfunction and autism and some of the treatments and their response to treatment. The first case is a 2.5-year-old boy who had normal development up to 1 year of age and then atypical development. His language plateaued at single words. His social interaction was impaired. He had inconsistent eye contact and response to name. He had an intense interest in numbers and letters. And then he had the sudden onset of staring spells, sometimes with hand and finger posturing, facial grimacing, and eye deviation. And he had a regression of language, communication, and social interaction over a 2-month period. He was classified as having autistic disorder. And as part of his evaluation, he had a 24-hour EEG, which was normal and showed that his episodes were not seizures. He had a normal brain MRI, and he had several lab tests, one of which, the plasma amino acid test, showed an abnormality of an elevated alanine to lysine ratio, which is a marker of mitochondrial dysfunction. So he was started on mitochondrial supplements according to the Johns Hopkins protocol, and within a few weeks his staring spells with posturing stopped. And then there was a reversal of his regression, where his language and social interaction returned back to baseline, and then he began to develop rapidly from that point on. He was also receiving a range of behavioral and educational interventions, and within 1 year he no longer met diagnostic criteria for autism. The second case is of an 8-year-old boy who was diagnosed with autism at the age of 16 months. And prominent clinical features included hypotonia, which is low muscle tone, muscle weakness, fatigue, poor fine and gross motor skills. He didn't walk until he was 2.5 years of age. He didn't speak until age 4.5 years. And he was suspected of having mitochondrial dysfunction at age 4.5 based on clinical features and some slight lab test abnormalities. And so he was started on several mitochondrial supplements. He began speaking within 1 month of initiation of therapy and had rapid developmental progress from that point on, and of course was also receiving intensive behavior therapy, speech therapy, and occupational therapy, as well as others. At age 8 years, he was no longer taking the mitochondrial cocktail. He was no longer compliant with taking it, and he had a sudden worsening of anxiety and obsessive compulsive symptoms. Compulsive hand washing, touching of people and strangers, unable to walk from one point to the next due to compulsive retracing of steps. He had a set of rituals surrounding dressing, and he had compulsive overeating and gained 16 pounds over 3 months. He also had a recurrence of migraine headache. And he had been started on several different medications, including fluoxetine, citalopram, sertraline, risperidone, and clomipramine, which were not effective for him, and also led to side effects, one of which was prolonged nosebleeds requiring cauterization, even on very low doses of medications. He was started back on the Johns Hopkins protocol and had resolution of his anxiety, OCD, and headaches. And the last case is of a 14-year-old boy who was diagnosed with autism at age 2 years. He also had diagnoses of ADHD, mood disorder, and generalized anxiety disorder. He had a family history of metabolic, neuropsychiatric, and autoimmune conditions, and he had prominent features of low tone, muscle weakness, excessive fatigue, incoordination, heat intolerance, and slow recovery from viral illness. He had multiple food allergies and severe constipation. He also had chronic ear infections and recurrent sinus infections, and he was of small stature and low weight. His progress in therapies was hindered by recurrent illnesses, and he had high fever and developmental regression following vaccinations and surgical procedures with anesthesia. At 6 years of age, he'd had screening tests for mitochondrial disease, all of which came back reportedly as being normal. But at age 14 years, he had repeat testing, which showed several markers of mitochondrial dysfunction. And this is a table summarizing some of his medications, supplements, targeting mitochondrial function, the dose, and the response to therapy, which included increased expressive language, increased energy and cognitive skills, and better attention and awareness. So what this diagram here on the right shows is a two-dimensional representation of the body's metabolism, so the biochemical pathways in the body. And I just want to point out that many of the interventions we think of as being holistic or integrative, in fact, impact what is really at the heart of mainstream medicine, which is the biochemistry of the body. So things like dietary modifications, nutritional supplements, exercise and lifestyle changes are some of the most important, most impactful ways we have of changing our body's biochemistry. It's also important to recognize that avoiding certain environmental toxins may be an important step in therapy. And this is a review paper published by researchers in England in the journal Lancet, which is one of the preeminent journals in the world for medicine. This was published in the neurology publication of Lancet called Lancet Neurology. And in this research review paper, the authors review the research evidence showing that industrial chemicals and pesticides used very widely in our environment have toxic effects to the developing brain. And so taking steps to avoid these is very important as part of a comprehensive treatment program. And there are many resources. This is one of them, and this is available. This was put together by the psychiatrist, Dr. Suruchi Chandra, and a copy of this is available on my website. So there are ways to reduce exposure to pesticides, to improve the quality of water and indoor air, to avoid exposure to indoor volatile organic compounds, to make cleaning agents more safe, to avoid flame retardants, to use cookware and food storage in a safer way, and other considerations in the products that we use in the home. And I'll just mention that understanding mitochondrial dysfunction is important also in influencing how we approach behavioral and educational programs, because psychosocial stress can have a direct impact on the function of mitochondria. So the autonomic nervous system is the part of the nervous system that handles the body's response to stress. The neuroendocrine system also has a very important role. And what we know is that certain mainstream approaches to behavior therapy that were developed many, many decades ago were done so before we fully understood the physiological and metabolic disturbances in autism. And applied behavior analysis, which is based in this field of psychology called behaviorism, was an approach concerned only with observable behavior and not with unobservable activity in the brain. And from the 1950s onward, has been replaced entirely by neuroscience and cognitive psychology. And there have been research studies, review papers like this one, showing that a lot of the research in support of traditional mainstream behavioral interventions actually is of low or poor quality. And so there is a lot of room for improvement in this area of intervention. And because from brain imaging studies we know that so many different learning and memory systems of the brain are impacted in autism, a comprehensive care program goes far beyond behavioral modification and should include attention to cognitive, executive function, sensory, and motor systems as well. And these are a whole set of different programs that we use at our clinic that were developed by Dr. Marion Blank at the Columbia University Developmental Neuropsychiatry Clinic. And here is our website with more information about our services.